The pandemic has had an impact on the numbers of people visiting emergency rooms at hospitals around the country and, of course, here in Connecticut as well. To talk about why is Dr. Cynthia Price. She is an emergency room physician at Hartford Hospital. Thank you for joining us, Doctor.
Thank you for having me.
Yeah, a lot of people probably are still afraid to go to the ER. Would you agree with that? And what do you want to say for people who are a little skittish?
Yeah, I don't know if it was all of everybody seeing away was just people being afraid. I also think it was a consequence of the weather and a consequence of people staying inside that we didn't see very many people here. We are now ready to receive everybody. I don't want people to be afraid to come to the emergency department. Of all places that have prepared, it should be us. We have plenty of PPE. Every visitor that comes, every patient that comes receives a mask. We've changed our triage way. We are utilizing a different formulation of coming in. You're going to be triaged outside. We have a tent for area. We have a waiting room that is not necessarily a waiting room. We've got a divided area out, and we've got smaller rooms so that people are appropriately apart when they are waiting to go to the back, or they are just being sent to the back or in a separate room. So we absolutely are ready to keep you safe here.
Yeah, and I think people are worried about being mixed with people who would have COVID symptoms. You have a way of separating people, right?
We do. Now, we also call COVID the great masquerader because it does have symptoms that sometimes are outside of that typical fever, cough, weakness. But as far as we can, if you have respiratory symptoms or if you have weakness, we are putting you on one side of the emergency department. And I, as a physician, when I work on that side, I actually don additional PPE as we want to make sure that we're keeping each other safe. The other side of the emergency department has people that have chest pain, an ankle sprain, a broken leg. We are trying to separate people as best we can, and everybody is being tested when they come to the emergency department if they're going to go to a bed upstairs, so that if you happen to get admitted, it is safe for you to visit because your status of the patient that is known when they go upstairs, their status is known so that we can make sure they are also in a safe place.
Right, so good that we now have much more testing in place, and I know you want to get the message out that it can also be much more dangerous to wait out serious symptoms like heart pain at home. So we want to thank you for sharing that message and let everyone know that it is safe if they need care.
It is safe. Don't wait at home. Please come see us. We don't want poor outcomes, certainly because you were sitting at home. We want you to come in. We want you to see us. We want to make you better and then send you back on your way so you can enjoy this lovely summer we're having.
Thank you very much, Dr. Perfect.
Thank you.